Hello, everyone. My name is Schachter. I'm the founder and CEO of Axiom. Thanks for spending a little bit of time with us going through an ePRO case study highlights about how to create, manage, plan for, and of course, execute a really great ePRO study. I'm going to walk you through an interesting case today and look forward to be able to talk to you a little bit about Fusion, who we are and what we do. For a little bit of background, we've been running clinical studies for over 19 years, developing e-clinical technology and the solutions and services to make it all work. So Fusion is an e-clinical platform, started life as EDC and data management and expanded over many years into RTSM, CTMS, and ePRO. And it is a single sign-on platform to all of the modules that you need so that you don't need to have multiple systems in different places. And we partner that up with a range of services that our clients require, starting off from data management, data analytics, clinical management support, project management, biostatistics, and pharmacovigilance. One of the most important things is that we bring together all of the key components, and we'll talk a little bit about that at the end of the presentation today. So let's talk about ePRO. Just as a little base of background, Fusion ePRO is designed to capture two different types of data: mobile phone, all of our mobile phones, we know what those look like, and on iPhone or Android, and on tablets. And of course, there are two different types of requirements, and we're able to manage both. So those questionnaires that patients are given when they're sitting at the clinic have an entirely different set of requirements versus when the patient's at home and working through the diaries and so forth that they go through. So we can provide both of those solutions and tools, and of course make it very easy for the site to avoid data entry of all kinds of questions, as we know, and then of course that data entry by the site needs to be validated as it goes through a process. All of that can be skipped, hand the tablet to a patient, and they go through the entire requirement. We also have the ability to capture data in other modes via the web, phone, so IVR, patient can call in once a day, and we balance all of that out with the appropriate text reminders so that they go through the whole process of being reminded of the critical needs around the study. Diving into the case study, so what does a successful partnership look like, and how do you manage a global ePRO study? Well, that all starts off by the critical aspects of what you're starting with, the needs, how do you design the diary requirements, what are the technology requirements, and then, of course, how do you manage the data that you have coming into the study. From a key perspective on what makes a good partner, from our perspective, it's ensuring that we have the same view on goals, an understanding of what the study is and what are the key things you need to make it happen, all the elements around how flexible is the team to be able to adapt to the scenarios that are going to come up, because one thing that's guaranteed to happen, put a study in front of people, it's never going to unfold exactly how we plan it. And of course, the appropriate tools and phenomenal support for the people going through it, be it the coordinators or of course the patients themselves. The study we're going to talk about today is a study we did with a client called Exonics, and what they needed to do was capture ePRO in both a questionnaire as well as in e-diary. They needed to have their inventory inside of the system where they keep track of everything, and then they required reporting so they knew everything that was happening with their study and how to ensure it was being done right. So when it came to setting up the diary, an e-diary is something where you want to ensure that you can literally pick up the phone, hand it to a patient, and about 90 seconds later, the patient's doing the things that they need to do. So in this scenario, the clients provided iPads to the sites, and the site worked with the patient to set up their login. That takes about 60 seconds, and then the patient's able to go in, do their questionnaires. The staff can do a quick check to make sure everything is done. And then, of course, it's uploaded in real time, so the coordinator doesn't have to do any data entry whatsoever on any of the requirements. When it came to the diary, this diary, I'll walk you through some of the logistics, but this diary was designed with a window in mind. and an expectation on a certain number of entries per day. We went with a single question per screen, making it really easy to be able to do that, and they were done the diary entry in less than 30 seconds per entry. They're in a position where all of the types of tools that they needed were taken into consideration. So key things for us were enable devices, so iPhone and Android, give the patient the ability to use their own device. We wanted to make sure that the data was complete because if you're going to do it electronically, we want to ensure that they didn't miss any questions. And then, of course, we really wanted to ensure that they were starting the diary at the right times. So compliance to ensure diary start, and then all kinds of useful reminders to ensure that the data entry was the right number of events. So this study was around incontinence issues, and of course they expect to have a certain number of entries throughout the day, and therefore we were able to ensure that the count over a 72-hour period was reflected, and that there weren't too big of a gap between the entries that were taking place. And then, as I mentioned earlier, the importance of the appropriate support. So in the diary specifically, we're capturing 72 hours of complete data, and because it's all being done in real time, we're in a position where everything that we would typically do by phone, calling them with a reminder to start the diary at a particular time, and all the things that would need to happen, as many of those are being done electronically as possible, and the coordinators are able to see in real time how their patients are doing, and they're, of course, given alerts about their patients to be able to manage them if they weren't compliant. In addition to that, should they drop the phone in the sink, phone wasn't available to them, and so forth, we had a backup methodology that enabled everything to be done on paper and then data entry after in the off chance tech wasn't available to them. So without a doubt, one of the most important things is how do you create tools that are really easy to use? And I'm only going to spend a moment here, but as a highlight, one, you have to make sure that it's incredibly friendly for the patient themselves because they're not going to participate unless it's really easy. Number two, you want to give them control of things. So in this study, it was a diary window, so we wanted to give them the ability to start that window when it made sense for them. Number three was obviously focused around all the checks that I talked about earlier because we really want good, clean data. And last but not least is the importance of notifications going out to the patient at the right time. So 8 hours have gone by and they haven't put in any entry throughout the day, there's a good chance that they've missed some. So making those smart reminders. So how do we design all that? It's all about going through an iterative process. There's no easy way to say it was done in 10 minutes. It's a lot of discussion. Design it, test it, model it out, try it out, go through that process, and go through that in a constant motion to ensure that we've captured all the scenarios. And it's a really easy process to do. It just takes some time and effort to get through and ensure that we've documented all the scenarios that are going to come up and capture them accordingly. We now have running a study, and then the important part is how do we deal with the data? Data is, of course, the most important aspect. So what we want to do is we want to design the needs of how the client wants to see the data before we release the diary. So to that end, it's conversation, it's then configuration, and then giving access into live data so that we can see exactly what that looks like, and of course taking into consideration the data itself, the formats that are needed, the audiences, because there are very different requirements from clinical than there may be from medical, and so forth. And visualizing as much of the data as possible so it's easier to read. In this case, the primary endpoint was driven by the data itself. So it really required groups of critical information. So the screening activity, the ongoing enrollment, and early analysis, and of course the data needed for the primary analysis endpoints that were part of the overall study. So that's how we grouped the information that we were thinking about And all of that turned into real-time reports so that we can see exactly what they look like. I will say that all these reports scrunch down into a PowerPoint, only present to a certain extent, but one of the most important things you can see in the middle of the screen here is highlighting data wherever possible. So we color code data in red, yellow, and green to highlight different stages of the data. We can see patients that weren't compliant, they jumped off the page, so we know exactly what's happening on a daily basis with all the subjects in the study. And at the end of the day, it drills down to that direct access into every data point, which comes out of Fusion instantaneously and on a constant basis. So Fusion's goal in life is really to be the connected hub to all the study data. That's our mission in life. When it comes to single sign-on and having access into everything, you really want to be in a place where you're not logging into 5, 6, 7 different systems to get access to your data. Because a lot of time is lost in that process where you're not efficiently being able to manage the study, you're spending time collating information. It's a methodology with us that we really believe in single sign-on access to data, dashboards that give you that critical view of everything that's happening, and then immediate and instantaneous access to data that's across all different types. So I want to see EDC data, ePRO data, and potentially central lab, and I want to have it collated for me automatically, so I'm not spending time going through that work. For us, it's what we call data-driven studies. We believe access to information should be transparent, and we believe that turns into faster and smarter results and gives you access to really what we refer to as the total ownership of the entire data stream. To that end, we think it really helps you manage the overall risks in the study and be in a position where you do a better job of managing the overall process and project that's in front of you. So we put together all the components. You'll notice data is at the top of the list. Access to data is at the top of the list in terms of reporting. And then capturing all the data regardless of where it comes from. And then for us, the importance of the various modules leading down to safety, adverse events, UTMS, and the appropriate services to be able to manage it. So Fusion brings them all together. I won't walk you through every bucket on this page, but they're obviously the critical things when it comes to pulling a study together. And as I mentioned earlier, we just fundamentally believe in the idea of owning your data relationship so that you're not logging into 6 different platforms that you don't have complete control of that data stream. So thank you so much for spending a few minutes with me. As I said before, my name is Andrew Schachter. I'd be happy to, of course, communicate with you and answer any questions that you may have. We have an incredible team who would be thrilled to walk you through a demo of Fusion, give you an overview of how we put together this ePRO study and so many more just like it, and of course, how Fusion can help run your studies that much better. Thank you so much and have a fantastic day.